We're back with Dr. Brown, Chief Medical Officer here at Kathy's Urgent Care in Rocky Hill. I know Dr. Brown and I are certainly enjoying the sunshine and warmer temps, but we also know that being outside increases our risk for Lyme disease, so that's what we're going to talk about today. So Dr. Brown, let's say I ignore all the great advice I've heard my whole life, which is like to wear long pants and shirts when I'm outside to avoid being bitten by a tick. And so I now notice that there's some tick burrowed into my skin. What should I do at that point?
Well, first off, let's be honest, we're all waiting for this time of year.
Yes?
It's 75 degrees out. You want to put your flip-flops and shorts on. Come on, let's be honest. We all want to do that. So maybe you can get away with that on your deck, though. But if you're going to go gardening or go into the forest or walk your dog, yes, you got to take precautions, like things you're talking about, DEET repellent and long sleeve shirts and slacks and all those not so fun things. So, but if you don't take the proper precautions and you find a little tick on you, take a deep breath, not a huge deal, and then you have to, we have to decide. So first off, most ticks aren't deer ticks. Deer ticks are tiny little things, like the tip of a pencil, very small. And a good percentage of deer ticks don't even host the bacterium that causes Lyme disease. So there's a good chance it's not a deer tick. It's a good chance it's a deer tick that doesn't even have the Lyme disease bacteria. And then there's other considerations, of course. How long do you think the tick has been on your body? Can you just pluck it off with your fingertips? You have nothing to concern yourself with, because it hasn't gotten under the skin. It hasn't become engorged, essentially drinking your blood. Excuse me, but that's what they do. And so the risk for being contaminated and becoming ill is nil. Now, if you think it's 24, 48, 72 hours, and the bacterium, the tick has really gotten underneath the skin, then you really do have to see the doctor right away, because then there's a significant concern for Lyme disease.
All right, so then I'm calling you. I'm coming into the urgent care, and that's it. But so let's say, though, now I don't see a tick. I don't, notice anything, but I'm not feeling well. Are there any particular signs or symptoms that you would caution people to be concerned over, to, call their doctor?
Yeah, it's a good question. So Lyme, like so many other illnesses in medicine, we kind of call them the great masqueraders, because, for example, classic Lyme symptoms are joint aches and pain, fevers, and fatigue. So who doesn't have joint aches and pains and fatigue from time to time? Folks with fibromyalgia, people who are tired and stressed out, et cetera, et cetera. But to answer your question, this time of year, in the middle of the winter, you get that, you don't worry about Lyme disease. Okay. In New England, this time of year in the summer, if you have joint aches and pains, a low-grade fever, and fatigue, you have to worry about Lyme disease, irrespective of whether or not you have had a tick bite or think you've had a tick bite, because they can burrow anywhere into your body, into your scalp.
Right.
You could have a pet at home, a dog that sleeps in your bed. You could have a tick bite in the middle of your back that you've never seen. I've seen them all over the place.
Yeah,
So you can't assume.
Right, so that makes a lot of sense. So I guess people were also wondering, how do you diagnose Lyme disease, and then what would you do to treat it once you had diagnosed it?
So Lyme disease is an interesting condition to kind of diagnose and treat, and I'll explain that. First, just some historical background. Of course, most people probably know it's called Lyme disease because of the outbreak in Lyme, Connecticut.
So it's cool.
So Lyme, Connecticut has its own history there, and essentially, in terms of diagnosing it, one, you want to see if the patient has some of the classic symptoms. Do they have aches and pains, fatigue, low-grade fever, neck aches, that sort of thing? Two, does the story suggest that they had exposure? They went camping the weekend before. They went to Cape Cod. They took the kids, and they didn't go through the scalp every single night looking for tick bites. They didn't do all the things. They didn't wear the bug repellent DEET spray. But if the story is consistent with a possible tick bite, And they might have some examination findings, for example, bullseye, target lesion, rash. So sometimes people will have a big bullseye rash right where the tick bite was, and then it doesn't take a doctor to say you have Lyme disease, right? So if you have that rash, you essentially have Lyme disease. So sometimes we treat empirically. We treat just because it's a good story, and we're concerned they have Lyme disease, and you don't want to mess around with Lyme disease. It can advance from primary to secondary to tertiary Lyme, and people's lives literally can be ruined by it. Now, if we want to be a little scientific, of course, we do blood work. Mm-hmm. The problem with blood work is every test is not perfect. So the test for Lyme disease is not a very good test in the first 2 weeks.
Okay, but you want to treat it.
Right, so you come in and see me because you were bit by a tick 5 days ago. You don't have any symptoms yet, but you're terrified.
Right.
And you're traveling out of the country in a week to a business trip. Your cousin had, late stage Lyme disease and her life was ruined.
Yeah.
You want to get tested. It's complicated because the test will probably come back negative because you were just recently bit. But neither the doc nor you wants to gamble.
Yeah,
so oftentimes
right.
we'll just treat for 3 weeks with an antibiotic called doxycycline.
Okay.
Very safe antibiotic. Now, long-winded explanation, I apologize. So if it's been 2 weeks or more, though, since the tick bite, the test is phenomenal. And so if you were bit 3 weeks ago and you're concerned about having Lyme disease, or even 3 months ago, we do the blood test. And if it's negative, you can take that to the bank. You don't actually have Lyme disease. And if it's positive, we'll treat empirically.
Oh, good. Well, thank you, Dr. Brown. That was actually really helpful for me, and I hope for everybody else too. And we'll see you guys next week.
Thank you.